being able to provide more hope and more optimism, that has been incredible. That's my favorite part about seeing people in clinic, is hearing all the things that they're excited about and doing and that they can do because they're not having to spend quite as much time, thinking about what's going on with the cancer. Hearing them talk about celebrating birthdays and going on trips with family, that's really what it's all about. Small cell lung cancer is one of the most aggressive types of cancer, and there have been very few advances over the past really several decades. Small cell lung cancer had always been treated as sort of a one-size-fits-all cancer. When we went back and looked more deeply at this, we realized that small cell lung cancer is really several different types of lung cancer. We've been able to identify drugs that look like they work especially well for each of those 4 types. We've also been able to develop new types of biomarkers that are specific to small cell lung cancer so that we can really start thinking about how would we match a patient who has small cell lung cancer with a specific therapy that's more personalized and hopefully more effective for their specific cancer.
What Dr. Byers has done is really do the science to look in the mechanism, look at what's going on in the tumor, and she's discovered things about how the wiring of cancers change that allow her to identify some of the vulnerabilities.
It's really exciting. In fact, we've seen some incredible results from some recent clinical trials with these newer drugs for small cell lung cancer. I actually get goosebumps thinking about it because it's probably the most monumental shift in terms of really seeing that there's a path forward and that we're going to be able to have much more effective treatments for these patients.
She not only is a great doctor, but also a great mentor by encouraging us, and also always keeping our sight on the end goal of improving patient outcomes. So it motivates us every single day, I guess.
Being at MD Anderson is really incredible because it means that the things that we are learning in the lab can rapidly get into the clinic to our patients. One of the ways that we really prioritize what we're working on is what do we think is the most likely to help patients and how quickly can we get that to our patients. The average survival had been around 1 year. Patients who had their cancer recur and have received this newer, more targeted treatment, their survival after starting that new treatment is over 14 months and still going. So patients who are responding to this newer type of treatment are essentially doubling or more, how long they're living with this cancer. We're actually just about to start the very first clinical trial where they'll be matched to treatment based on their subtype and their biomarkers.
She treats patients. She also runs her own lab team and conducts state-of-the-art research. I think that should be an inspiration to every physician scientist.
I feel very grateful to be here and to be someplace where it really is inspiring. Every single person who is here is proud of what they're doing and looking for how they can contribute. I think that that's really special.